Hello guys, welcome to my channel. So today we are going to discuss about open kinetic chain and closed kinetic chain exercise. So first to go for open kinetic chain exercise. So open kinetic chain exercise involve motion in which the distal segment is free to move in space without necessarily causing simultaneous motion at the adjacent joint. Muscle activation is occur in the muscle that cross the moving joint. Example, if in knee flexion, during the knee flexion, the action of hamstring is independent of requirement of other hip and ankle musculature. Then you go for the closed chain exercise. In closed chain exercise involve motion in which the body move on a distal segment that is fixed or stabilized on the support surface. So the movement at one joint cause simultaneous motion at the distal as well as the proximal joint in a relatively predictable manner. Example, in squatting. So when a patient performing a squatting and then returning to the erect position as the knee flex and extend, the hip and ankle move into a predictable pattern along with the knee. Then you go for the characteristic. So what is the difference between open kinetic chain and closed kinetic chain exercise? So in open kinetic chain exercise, distal segment is move in space, but in closed kinetic chain exercise, distal segment is remain in contact with a stationary on a support surface. Then in open chain exercise, independent joint movement, no predictable joint motion in the adjacent joint. But in closed chain exercise, there is interdependent joint movement, relatively predictable movement pattern in the proximal or distal joint. Then you go for the open chain exercise. There is movement of the body segment only distal to the moving joint. But in closed chain, there is movement of the body segment may occur distal and proximal to the moving joint. In open chain exercise, there is a use of only external rotatory loading, but in closed chain exercise, there is use of axial loading. Then go for our next point, in open chain exercise, there is typically performed in non-weight bearing position, but in closed chain exercise is all no, but not always, but perform in a weight bearing position. In open chain exercise, resistance is applied to the moving distal segment, but in closed chain exercise, resistance is applied simultaneously to the multiple moving segment. Then in open chain exercise, there is external stabilization. There is manually or with an equipment usually required. But in closed chain exercise, there is internal stabilization by means of muscle action, joint compression, and postural control. Then in open chain exercise, there is muscle activation occur predominantly in the primary mover or isolated to the muscle of the moving joint. But in closed chain exercise, there is muscle activation occur in a multiple muscle group, other distal and proximal to the moving joint. Then you go for our next is how we can progress our open chain and closed chain exercise. So first to go for open chain exercise progression. So first factor is the intensity. How we progress our intensity in an open chain exercise. So first we go for a sub-maximal load. Then go for maximal. Like you can say in low load to high load we can progress. Then you go for repetition and set. So first you start from low volume. Then you go for high volume. Then for type of muscle contraction, first you go for static, then you go for dynamic. Then in range of motion, first from soft arc, then you go for full arc. Then in plane of movement, first you go for uniplanar, then you go to multiplanar. In speed of movement, first slow, then we progress into fast. Then in functional movement pattern, first you do simple, then you go for complex. Then in closed chain exercise, in closed chain exercise, there is weight bearing was permitted. We started closed chain exercise. So when a patient become able to bear his weight, then we go for closed chain exercise. Otherwise, we only do open chain exercise. So first parameter is the base of support. So how we can progress? So we give a patient in a wide base, then we progress it into a narrow base. Then from bilateral stand to unilateral, means first we start from a patient with double leg standing, then it comes to it in a single leg standing. Then for balance, first we start with external support, then no external support. Then after that we can first we start with eye open, then we do eye close. Then exclusion of limb movement, first you go for smaller range, then you go for larger range or short arc to full arc. Then speed of movement, first you go for slow, then we go for fast. Then in a percentage of body weight, first we ask the patient to put only partial weight, then we can ask the patient to do full weight. So in lower extremity, first for partial weight we can use aquatic exercise, like in hydrotherapy people you can start our exercise, then we progress into the parallel bar. In upper extremity, first we do the wall push up, then we go for prone push up. So with then we can progress into full weight or additional weight we can use. Then support surface. So first we ask the patient to do the exercise in a stable surface. Then we progress into a unstable or moving surface. Like for upper extremity, we can use first floor or wall. Then we progress into rocker board or wall. Then in lower extremity, first we start from floor. Then we progress to wobble board, treadmill, and the how the floor. So first we started with a rigid floor, then you go for soft floor, because the soft floor need more balance or more stability as compared to rigid floor. So there is floor, table, then we go for carpet or sand, we can do the surface. Like first we go in a rigid surface like floor, table, then we progress to a soft surface like carpet, sand. So in carpet and sand that is more difficult than a floor and table. Then you go from height. So for height, that is from first we do from a ground level, then we increase a step from low to high step we can increase. Then plane of movement, first we do uniplanar movement, then progress to multiplanar. Then anterior posterior diagonal movement, forward, backward walking, step up, step down, lateral walking, lateral step up. We can progress like this. So there is some indication like in open kinetic chain, we can done in a case and operation healing fracture, osteoporosis, isolated muscle group strengthening, or acute phase of hemiplegia. But the close kinetic chain exercise you can do in ligament injury, rotator cuff injury, balance problem, post-operative grafting we can use. So there is some picture of open kinetic chain exercise you can see in upper limb. There is first in a scapular movement, then humerus, the shoulder movement, then elbow movement, then wrist movement is there. In a progressive open kinetic chain exercise, these are using TheraBand. We can give them resistance with a single movement. We can see discuss it previously. You can see the hip movement, knee movement, ankle movement in a open chain exercise. Then you go for closed chain exercise. So for these are the starting phase of closed chain exercise. Then you progress into a treadmill surface, you can see first you start from wall push up, then you go to full prone push up, table push up we can do. Then in a progression you can do the normal plank to side plank, or you can push up in a Swiss ball, or one hand push up, wobble board push up. Then on a squatting, these are the closed chain exercise starting phase like squatting, treadmill, pulling, lunges. Then toe, standing, step up. This is the starting phase. Then in progression we add strength TheraBand to during squatting. We use resistance band during lunges. Single limb squatting we can do. Weight bearing with lunges we can do. With single limb toe standing we can do. Wobble board balancing we can do. Thank you.